Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Leucopenia, sometimes called leukopenia, is a blood condition. It means you have a low level of white blood cells. White blood cells are crucial. They fight infection in the body. A low white blood cell count makes you more vulnerable. You're more likely to get sick. There are different types of white blood cells. Neutrophils are the most common type. They are the first line of defense against infection. A low neutrophil count is called neutropenia. It's a common form of leukopenia. The severity of leukopenia varies. It can range from mild to severe. Severe leukopenia can be life-threatening. It's important to understand this condition. Early detection and treatment are vital. Leukopenia itself is not a disease. It is a symptom of an underlying condition. These conditions can range from minor infections to serious diseases. We will explore these causes in the next section. Leukopenia has many causes. One major cause is bone marrow disorders. The bone marrow produces our blood cells. Conditions like leukemia can affect this process. This can lead to a decrease in white blood cell production. Certain autoimmune disorders can also cause leukopenia. These disorders cause the body to attack its own cells. In this case, it attacks white blood cells. Examples include lupus and rheumatoid arthritis. Viral and bacterial infections can also suppress the bone marrow. This leads to decreased white blood cell production. HIV and tuberculosis are examples of such infections. Chemotherapy and radiation therapy used to treat cancer can also suppress bone marrow function. Certain medications, apart from chemotherapy, can also lead to leukopenia. These include some antibiotics and antipsychotics. Malnutrition and vitamin deficiencies can also impair the production of white blood cells. Recognizing the causes of leukopenia is the first step. It allows for prompt diagnosis and treatment. Let's move on to the signs and symptoms of this condition. Leukopenia doesn't always cause noticeable symptoms. Often it's discovered during a routine blood test. However, people with low white blood cell counts are more susceptible to infections. These infections can manifest in various ways. Fever is a common sign of infection. It can indicate that the body is fighting something. Frequent infections, even minor ones, can be a sign of leukopenia. These infections might be slow to heal. Mouth sores, gum infections, and skin infections can also be signs. These areas are vulnerable to bacterial entry. Fatigue and weakness can also accompany leukopenia. This is due to the body's ongoing fight against infection. If you experience any of these symptoms, see a doctor. They can determine if leukopenia is the cause. Section 4. Diagnosing leukopenia. Diagnosing leukopenia is straightforward. It starts with a simple blood test called a complete blood count, or CBC. This test measures the levels of different blood cells, including white blood cells. If the CBC shows a low white blood cell count, further tests are needed. A medical history review is crucial. The doctor will ask about your medical history. This includes any medications you're taking. A physical exam will also be conducted. This helps to identify any signs of infection. Depending on the suspected cause, more tests might be ordered. This could include a bone marrow biopsy. It could also include tests for specific infections or autoimmune disorders. Early diagnosis is key to managing leukopenia. It allows for timely treatment and prevents complications. Section 5. Treatment and prevention of leukopenia. Treating leukopenia involves addressing the underlying cause. If a medication is causing the low white blood cell count, the doctor might adjust the dosage or switch to a different medication. For leukopenia caused by infections, treating the infection is the priority. This might involve antibiotics for bacterial infections or antivirals for viral infections. In some cases, medications called granulocyte colony stimulating factors, or GCSFs, might be used. These medications stimulate the bone marrow to produce more white blood cells. Preventing leukopenia involves minimizing risk factors. This includes practicing good hygiene to prevent infections. Eating a balanced diet can also help ensure your body gets the nutrients it needs to produce white blood cells. If you have any underlying health conditions, managing them effectively can help prevent complications. Leukopenia, while a serious condition, is manageable with proper care. Regular checkups and open communication with your doctor can go a long way in ensuring you're well-being. UMCC, your ultimate medical consultant connector.